Hi, this is my Automix impression eval. For this eval, the PPE you would need would be mask, gloves, and glasses. For materials, you would need your Automix material, your cartridge of your polyvinyl syringe material, a dispensing gun, a mixing tip, your putty material, and your impression trays. You'd also need some measuring scoops, a timer, 2x2s, alcohol, and paper towel. So to get started, you would place a small directing tip at the end of the mixing tip and squeeze a small amount of the material out of the dispensing gun to make sure that the openings are clear. And when there's a homogeneous mix, you can hand the dispensing gun correctly over to the doctor, plunger side first. I would demonstrate this, but I don't have any putty-like material, but while the doctor would be placing that, you would take your pre-measured balls of putty and you would mix together for around 2 minutes. And then you would place that material on both sides of the impression tray, and then you transfer the loaded tray over to the doctor. It takes about 2 to 6 minutes to set, and after the impression is taken out of the mouth, it needs to be rinsed. For cleanup, you can dispose of the mixing pad and the other disposables that you'd use. You would disinfect all materials, your containers, and the gun syringe. For disinfecting the impression, you'd place it in a bag labeled with the patient's name and use a disinfectant spray to spray the inside of the bag according to manufacturer's instructions. Afterwards, you would rinse with water, and then it would be placed in a biohazard bag labeled with the patient name and date.